Dear Dr. Morse and team, I have a query regarding scar tissue and stretch marks. We've talked about this one before. I have them on my hips and breasts, etc. If I started detoxing, could I expect them to get eaten up? And if so, how long may that take, months or years? I'm going to say probably more like a year or better. That's just going to be a guess because you have to take a look at a couple things. Excuse me, please. When you see someone that has excessive scarring or well, I guess we could say adhesions and stuff like that as well, but scar marks from being pregnant or having large breasts and really, I have to pause to where would we first want to go? What's the first type of tissue that makes things, tone things, and keeps things toned? Connective tissue holds things in place, right? And it's everywhere. That's where the body can borrow some calcium to fight acidosis. In that advent, we just got through talking about it, you're going to lose the structure. So now you get prolapsing. Your bowels sink down. Everything starts sagging. And you can see, as you lose weight, the skin doesn't tone with it. And then extreme acidosis, where you have, say, fibroids and stuff, you can get major scarring. Scarring and all these things like this fall under which side of chemistry? There's only two, so take a pick. Obvious. Acids. And so that's what you always have to go after to remedy the effect of acids. You've got to eliminate that. How are you going to get well not eliminating the cause of the problem? And if you're going to blame the cause on some diseases that the medical mind fabricated, you can do that, and you can try to treat it, but you're going to end up like every other person, seeking many medical doctors or many naturopaths trying to find the answers of wellness. And it's right in front of your face. And you could use the burn salve. You can use the burn salve on those stretch marks and stuff because it is a lot of healing. Grapeseed oil, excuse me, grapeseed extract oil, very healing, very nutritive and very healing. Comfrey, root and leaf, very healing. To tissue, remember, comfrey is called knit bone. So comfrey, root and leaf, one of the greatest herbs. FDA doesn't like it. Of course, they don't like us at all. They shouldn't have any jurisdiction over us at all. They're in the medical field. We're not medical. Now, I also have another question. I water fasted some time ago and all was well, but once I had finished my fast, I noticed my breasts had reduced in size. However, the skin had not reduced with them. And see, that's part of the problem. And that's quite obvious. When you're a larger woman, you lose weight, your breasts shrink, but the skin can stay pretty, flabby. I have to say that I'm going to think parathyroid. So when I'm going after a case like yours, I'm going to go after the parathyroid gland. You don't have the tone. See, and another problem is, and I see this with the young people who come up in houses on TVs and on their Nintendos and things like that. They're not building underneath muscle mass, and they're flabby. They have no tone or muscle to them. Heck, when I was a young man, I was throwing bales of hay way up on hay bales, up on wagons. So it's a big difference. And if you don't develop underlying muscle, crawl around, build, work, run as a child, you flabby. And if you have a parathyroid weakness on top of it, you're really flabby. Flabby butt, flabby breasts. And you want to seek to remedy that because as you get older, it is not the prettiest. You want to stay as a 60, 70-year-old woman, toned and looking good. Same with the men. But the men down here get big-ass bellies and all kinds of things, and, you look gluttonous. So keep yourself toned. To keep yourself toned, you got to go to the raw foods, which we should be eating anyway. And then, of course, our species is a fruit, berry, and melon species. And work on your glands. But I'd be working on my parathyroid, thyroid glands. And that's going to tone connective tissue and help tone yourself. Because that's all I know you can do, and let the body start building muscle mass and toning. Can that skin ever return to being taut? I think so. A lot of women have done that. Melanie, can a raw food diet help eliminate stretch marks? Absolutely. Matter of fact, you notice the more acidic you are, the worse the stretch marks. And not only just stretch marks, scarring. Just say you accidentally rip your skin. The more acidic you are, remember, the more pain, the more swelling, and the potential for scarring. But understand what scarring is. The same thing with fracture of bones. And so it's just the body trying to protect itself. The body always seeks strength. Nature always seeks strength, get rid of the weaknesses. And we have to remember that, because nature is always trying to attack and eliminate the weaknesses. Well, don't feel bad when your body's trying to get rid of those cells that are weak in it. The problem is the highways are blocked. But yeah, Melanie, definitely. You could use the grapeseed oils and all that stuff on that to get under the skin, but I'll tell you the honest truth. You just get into the body and get it in the alkaline states, and you will see a lot of changes to the body you'll like. I would also point this one out. So I'm going to ask you guys first. What other gland might I want to think about when I'm talking about the regeneration of tissue? Parathyroid gland, because when you're looking at strengthening, and mostly you're looking at connective tissue issues, skeletal issues, and things like this, not just tissues, not just basic tissues. So there's a matrix involved. So always calcium is a big component, and a big component of nerve transmission. It was said sometime the body is 96% type calcium in terms of minerals and stuff. I don't know about that. I know it's enough to say, because I don't trust research anymore. There's so much bogus stuff out there and so much claims that I'm pulling back from that. I only want to know what's true, what works, because there's so many claims, and most of them I've already experienced and are not true. Through all my years, I've tried literally everything out there. MSMs, beta-glucans, you go right on down the line. Right on down the line, I've done them all. I've not done urine, stool. There's no way. I would never recommend anything like that. But you want to work on that and strengthen, tone and strengthen, and your body will tone and strengthen. That's what's cool about regenerative detoxification, because as you clean, your body strengthens. But it would, because you're working on the proper side of chemistry. We've been digging and eating into the acid side of chemistry. Is it any wonder the blowback is acidic? Of course it's no wonder. It's obvious. So once we understand that, we change that, then everything rights itself. How beautiful that is the ability of nature to right itself. Big time. Thanks for the question. I am trying to help myself, but I am lost on what to do. I tried to get advice from doctors, healers, etc. about a mysterious skin condition. All right. Lumpectomy, scar overgrowth, or lumpectomy, scar overgrowth issues, and itching all over that I don't even know what to call it. Well, here we go. You have a lumpectomy. So, again, where are we going? We don't have a lumpectomy from blood, do we? That's not a blood clot that this lady, had to be a lady, right, extract. Right? This had to be a tumor. Well, tumors are not blood clots, although they could have a blood supply because they're interstitial. Interstitial means they're part of the spaces around the cell. In other words, a cell isn't a tumor. They can be in a tumor, because a tumor is a pocket of what? Fluid. Now, a pocket of what kind of fluid do you think is predominantly in a tumor? What's Dr. Pimple Popper? What's Dr. Pimple Popper open up a tumor? Oh, yeah, and necrotic and stink. Sewage, baby. And that is of the lymphatic system. So what's the skin role in the lymphatic system? The third kidney. Remember, the kidneys are the eliminative organs. They're not just sitting there looking pretty. They're eliminative organs. You only have a few. The colon is for digestive waste. The two kidneys, and notice how you have two kidneys and a large skin to eliminate metabolitic waste, where you only have one little hole that eliminates digestive waste. Interesting, huh? So it shows you the vital importance that the Maker had in thinking about the sewer system in the human body. Just because medical doctors play the ignorant role, that's okay for them. But we can't play that anymore because the destruction of the human race is at hand. You can see it. Yeah, so here we go. Now, scar tissue. Just to talk about scar tissue, guys. You ever see a fracture and an x-ray, and the body builds a lot of extra cells, or you can call it bone, around that fracture, and you can see where around that fracture the body overcompensated in rebuilding it, and then when the coast is clear, everything is strong again, it takes those cells back away and it looks like regular bone again. All right? Scar tissue is the same way, and the same as adhesions. You go in and you have surgery. You generally have surgery in a highly acidic, weakened area. So when you do that, the body has to then, because you already created even additional weaknesses, because you cut through the muscle, you cut through all these areas, and now the body has to re-strengthen that in an area where it can't be strong in the first place because it's falling apart. The tissues are breaking down because the acids have accumulated in that area. Well, acids don't accumulate in the blood, so broken record, lymphatic, absolutely. That's why they're called lymphomas, and why this is all lymph node removals and lumpectomies and stuff like this, absolutely. Scar tissue is just the body overcompensating to you see that. I've spent a lot of years dealing with open heart and stuff like that, and you can see those ribbons down through here, just super scarring itself. And it shows that the patient was so acidic. Well, why do you plaque? Plaque or cause stenosis or hardening of the arteries? It's all about acidosis, guys. It all leads you down the same road. The skin was normal after surgery, a regular surgical scar, but by 2013 the scar overgrew a lot and abnormally. Well, it shows you that just because you had a lumpectomy, the whole tissues in the breast are highly acidic. Highly acidic. And so you had surgery through that. And so now the body is overcompensating like crazy. So you have you have to go back and fix this scarring problem and this breast problem the same way you should have your tumor in the first place. In other words, it always comes back to God is going to always take us back to fixing it the right way the first time. And so if it's a second or third time, we still have to go back and fix the cause of the problem. And that's why I have this site for you is go to the cause of the problem, don't treat the symptoms. And sometimes you have to treat the symptoms, I get it, but focus on causative factors always. And then you'll be successful and everything will turn out pretty. So you've got to go back and become a raw foodist. You want to particularly get up on your fruits, your berries, and your melons and live that way for a while. Clean your lymph system. Get these breast tissues cleaned up so you can get more of an alkaline reserve in there. Healing can take place. Your scar can back down and everything. It might take you a while to get that scar out of there and to stop the scarring, but it shows you how acidic those tissues are. It's reddened and looked like a pocket and sometimes crusted and gushes blood and yellow liquid. So it's just showing you, honey, that your lymphatic system is so backed up there in the breast tissue. And this is just a port. Just consider that little whole area a port. Lucky it's not in the nipple, because that's where they love to go, and it destroys the nipple. So you have to be careful there. But this is a port, all that nasty yellow stuff, and that can stink. You know, this is all your lymph system. The blood, yeah, that's part of interstitial fluid, yeah, but it's also how you keep a little alkalinity in that area as well. There's positive things with that as well, but, you know, you're just showing you that you have a lot of nasty lymph stagnation in that breast. Hopefully those lymph nodes removal won't stop you from cleaning them. I tried many remedies, reduce the scar, but nothing, because you're trying to treat it. You're trying to treat this problem that you can't treat. See, I think you guys particularly, the smartest ones on the planet, in my opinion. I'm a little biased here, but I love my YouTubers. You guys get it. You can't treat, because treatment has led man down to Hellville. Now people are struggling to reach out to help me get out of Hellville. because medical people have taken you into these dark areas of despair, pain, and suffering. Because you can't treat, particularly with pharmaceuticals, even the natural ways, you can't treat. You'll do a little better, but you can't treat. You got to go to causative factors and fix this. I even used a Chinese snake skin oil that left me feeling like I was weak and poisoned. That's what I'm saying, you know. I mean, don't treat. Eliminate. So you've got to detox yourself. You've got to get your kidneys filtering, your skin is sweating. You've got to get this lymphatic system moving and hoping your body will rebuild those 2 lymph nodes and start getting all this sewage out the right way, or the skin is the way out. You know, it's going to find a hole. It's going to find an opening, whether it's a belly button, whether it's the vaginal cavity, whether it's the rectal cavity. You can ooze stuff out of the rectum too. Nasty, stinky stuff out of the rectum too. You can ooze stuff out of the nipples. You can ooze stuff out of your eyes. You can ooze stuff out of your ears, your mouth, your nose. Or the body can make a hole of its own. You know, I mean, it does that. You know, your body's trying to get rid of, and all medical doctors do is say, well, let's just keep it in there. Let's just treat that. Really? Yeah. Well, that's why we get to the level we get, and then you're in trouble, and we try our best to get in there as fast as we can to try to open up these doors and fix the cause of these problems. And that's what you have to learn, sweetheart, is you've got to go after the cause of this problem now, no matter what it takes you, because you could lose that whole breast in time. It'll get all red, then hard, and now you're in start to deteriorate the breast tissue. About a week ago, the scar was bothering me, and I scratched it a lot, but I didn't pay any attention because I was busy. The next morning, the scar and my entire breast was bright red, and the redness was spreading toward my back, and I had a fever. Yeah, you were just stimulating the lymph system by doing this. You were just stimulating the lymph system. And the fever is a good thing, because the fever is trying to get your body to open up. You're not obviously not eliminating well from the kidney on that side. So your body's going to try to push it through the skin, try to get you to sweat, try to ooze gook out of your holes. You just really got to open up that kidney matrix badly and as fast as you can. I'd be putting myself on a grape diet, 30-day grape diet, some dry fasts in there, hit myself on an herbal program, go after the kidneys, the lymphatic system. I'd be doing that like yesterday. I tried to take colloidal silver. No. If you're trying to treat the fungus, colloidal silver, which can turn you blue. Remember the guy that turned blue to colloidal silver? And then it unbalances all your other minerals. No. Garlic and Herbal tea, and rub the area with coconut oil, clove oil, but the condition wasn't getting better. Yeah, I mean, you can't treat it. I mean, you can use some of the oils just to keep the inflammation down, but really, you're going to just add to the problem. You really got to go through the kidney channel here and get that opened up, dear one. It's just the only way that I know. My daughter told me I needed to go to the doctor in case it was cellulitis, and it's a lot worse than cellulitis. In the end, and that's a daughter that's got to come to our level 1 class and understand this. In the end, what it was, and the doctor said it was severe and life-threatening. Yeah, that's your acidosis. That's your lymph system. That's what damages cells and makes those cells become what they call cancer cells. But it just destroys your cells. Well, what else is left? You know, acids are going to destroy the tissue, which the tissue are cells. The fluid there is backed up. That's the fluid that's destroying the cells. I had no choice but to go on antibiotics, which were really heavy and had made me weak. I was told I have to go to a surgeon to see about the scar overgrowth and make sure that the scar is not going to cause more infections. You know, that's their brain is lost in the world of infections. So whenever you hear the word infection, where does that take you? My people on YouTube, you guys know the truth. Where does that take you? Sewage system. Sewer system, infection, sewer system. What's another name for the sewer system? The lymphatic system. There's nothing else. We don't live in la-la land like the medical doctors do. We live on the land of truth, honesty, integrity, and science, baby. Not pseudoscience like medical doctors. They'd have to blow that back on us. So really? Then how come you're not curing anything? How come you're making everything worse? And that's not the problem. If anything, you should have taken antifungals. But that's not the problem. The sewer system is the problem. The acidosis is the problem here, honey. And my other daughter mentioned this situation to a naturopath doctor who thinks that the scar is causing lymph blockages. Well, why don't we reverse that thought? All right? Reverse that thought, Mr. Naturopath or Miss Naturopath, who thinks that the scar is causing lymph blockages. Let's reverse that thinking and say that lymph blockages is causing the scar. Hello! I mean, even the naturopaths are being stupid. I mean, this is ridiculous. Get your lymphatic system focused, honey. You get yourself going. You get on your herbal program here. Go after this aggressively. Get on a great diet, but get your lymph system moving. Then go out with a wash, but you got to get your kidneys filtering. You got to see sediment in your urine. Pee in a jar. You got to see sediment in that. Get aggressive, but you want to be on a fruit diet like yesterday, because that's the only remedy you're going to get before you start destroying a lot more cells. Right now, you see a lot of lymph sewage, a lot of fungal problems, but you're going to start seeing cellular damage, and this is where it starts to get real ugly, and this is not where you want to be. So Marta, go after this aggressively, get involved. This is easy for our group to understand why you're having this problem. It might not be easy for other naturopaths and other groups like that. That's because they're treating symptoms and they don't understand what you beautiful souls out there understand. The broken record called, let's hear it, the great lymphatic system and how it really works. The sewer system, the immune system of the human body. Remember, the kidneys and the skin are the eliminative organs. You must filter, you must sweat. So go after it, have some fun going after it, or it ain't going to get any better. You keep trying to treat to stop it. You can't treat it. You can't make it just disappear magically. This is chemistry. You can't just make it go away. No, you have to work on why. You have to go after the causative factors of this.